So, hi friends, I'm Dr. Anshul Bansal again joining you on this Unacademy platform. In today's session, we'll see the first part of our special series, that is Inside Ortho OT. Okay, so I've taken a session of it, but due to some technical problem, the video was not playing. So, in this session, we'll see the videos, जो भी इससे related theory part that we have covered in that lecture. So in today's lecture we'll only see the videos and a very exciting and a new session, that is inside orthoti. So in part 1 we'll see the videos and about the hand washing techniques, the scrubbing, painting, and draping of the patient and the concerned limb, the operative part before the surgery. So these are the basic things, and these are very, very important to maintain the sterility, because a small because due to any some small problem, or due to some small error from the surgeon's point of view, the entire surgery can be infected, and it can be a very problematic and very bad thing for the patient. And such things are very small, and in day to day routine it is very easy to follow them, only you have to be a bit cautious. So let's see these videos. And before starting the videos, I would like to introduce myself. I am Dr. Anshul Bansal. I am currently working as an orthopedic house surgeon in SMS Hospital, Jaipur, and I have cracked the NEET PG examination last year, that is in 2020 only. And here are various subscription plans available for the NEET PG on an academy. The first one is your Plus subscription. The Plus subscribers will get access to the entire live as well as recorded classes. They can access our entire QBank, and they can compete in live tests and quizzes, all of which is formed by the topmost faculty for the NEET PG in India. And also we'll allow the subscribers to log into multiple devices with the same account, so that they can study on any device of their choice at any time. And also for the subscribers who will be subscribing for 12 months or more, we will be shortly providing them with a printed notes. While subscribing, you can use my code, that is Anshul B10, to get extra 10% off. The second one and the best one is your iconic subscription, and it is best not only on the Unacademy platform but across any digital platform in India for the NEET PG. And what makes this best is that apart from the things that I've told you earlier, in Extra May you will get the prep ladder and all of the prep ladder, including its entire QBank, video lectures, rapid revision courses, GTs, grand test, etc. And on Unacademy Extra May you will get well structured live batch wise classes, and also you will get an individual test assessment sheet after every test that you give, so that you can analyze yourself and you can analyze your preparation, and you can analyze, yes, this topic or this subject needs more revision, or what are the things that I am missing. So all these are very important for planning for any competitive examination ki preparation, and all these is included in the iconic subscription. And you can subscribe for the iconic subscription using my code, that is Anshul B10, to get extra 10% off. Now, special classes, I always focus and emphasize on the special classes, because they'll give you extra edge over your competitors. Plus, they will give you live classroom like feeling. In the live classes, you can interact with your educators, you can raise your hand, participate in polls, clear your doubts there and there. And what you need to do for attending the special class, you just need to download the mobile application and log in using my code, that is Anshul B10, and both of which are absolutely free. And also for every special class you will get the digital notes of that special class also. Now, a QBank is very effective. It contains 25,000 plus questions, but the major advantage of a QBank is that it contains every type of question that is necessary or that can come in any type of examination. The questions will cover your entire theory part. The question bank includes the recall and the previous year's high yield MCQs, the instrument based questions, the um, images, x-rays, CT scans, MRI based questions, the very important clinical based scenarios and clinical cases wale question. Okay, the recent advances is everything is included in this QBank, so you should solve this QBank before going for any competitive examination. And also we have launched a new feature called as raise a hand feature, and this feature is launched to make our live classes more interactive and to increase the communication and interaction between the students and the educators. So you just need to tap on a button so that you can digitally raise your hand, and the educator will come to know about your doubts, and you can clear your doubts and query there and there only. And dedicated to the 2022 aspirants of the NEET PG, we have started a dedicated batch for them, and also a very special and important clinical case discussions and instrument batch is also started. And this is important. Why? Because sometimes the things that you read theoretically, you are not able to understand them or correlate them, but when you see those things in a patient or clinically कि yes ये ऐसा दिखता है जो मैंने थ्योरी में पढ़ा है, so you will make your concepts बहुत अच्छे से, as well as you will never forget those things, and most importantly it will generate your interest towards your studies, which is very important. So please do subscribe for this batch, and you can subscribe for any of the above courses, and while subscribing you can use my code, that is Anshul B10, to get extra 10% off. Here are the subscription plans of our iconic as well as the plus subscriptions, and here you can see that the cost per month decreases significantly if you increase the duration of your subscription. So economically be it is beneficial, and also academically also it is very good, because from the word go you need to have a single trusted source of information, and Unacademy provides all of the things that is necessary for cracking any examination. And you don't want to hop around to different platforms for reading different topics or different subjects, because this will make your revision very difficult, as well as you will not be able to develop your concept. So please do go for the subscription package with longer duration, and while subscribing you can use my code, that is Anshul B10, to get extra 10% off. Okay, so let's start today's lecture about the Inside Ortho OT Part 1, where we will study about hand washing before the OT. Then we'll see how to painting and draping. And also we'll see one more thing, that is the donning and the doffling. Okay, donning means wearing, donning of gloves means wearing of gloves, donning of gown means wearing of gowns, donning and doffling. Okay, doffling means removing the gloves or removing the gowns, etc. So we'll see all about it today in the form of videos, the real-time videos inside OT of our hospital, that is SMS hospital. Okay, so let's start the first video. In first video, sorry, I'll tell you about the basic initial steps of the hand washing technique and the basic attire. So this is the basic attire of inside any OT, where you have to wear the OT dress and the cap and the mask. Okay, generally we wear two-layer mask in COVID times. One is the your N95 mask, and above that we wear the surgical mask. Okay, so let's start the video. So hi friends, in today's session I will teach you about the ways of hand washing before going to a ortho OT, and in fact inside any OT, and then we will see how to paint and drape the patient before the surgery. Okay, so सबसे पहले before entering the OT you should wear the cap and the mask and the OT dress. Cap is for coverage of the hairs, and mask में basically three things you have to cover. First are your nostrils, second is your mouth, and third are your beard के hairs if there is anything. Okay, so first of all I'll teach you about the hand washing techniques. Very simple. Okay, सबसे पहले the timing minimum 3 minutes बोलते हैं कि minimum 3 minutes होना चाहिए, but in general it should be around 3 to 5 minutes at least. Okay, so let's start the procedure. See, here I have soap, the water, and we use here the iodine solution scrub, that is 7.5% that we use for the scrubbing and hand washing. Okay, so let's start. So here I want to interrupt and I want to tell you one thing, that 5 minutes minimum time we say कि you should do the scrubbing. And what is the procedure? Initially you wash with the soap, then with the scrub that I have shown you, then you rinse it or wash it off with the water. Okay, so you use the same technique, all the steps of with the soap as well as the scrub, and you start with your hand, then to the forearm, and above 2 centimeter above the elbow, yahan tak you should do. Okay, so in this video I have applied the soap as it is. Okay, I have not followed this step, all the steps in the soap wala part. Okay, but I have followed all the steps while using the scrub. So see to it and watch the video accordingly. Okay, so hi friends, here I have soap, the water, and we use here the and hand washing. Okay, so let's start. So सबसे पहले we use the soap and once you have started the tap, you will not touch the handle of the tap again. Okay, some assistant or some staff will close the tap. Okay, you will not touch the tap now, or you will not touch anything apart from the sterile OT trolley, and you will not touch anything else apart from the trolley or the things on the trolley. Okay, remember this. Now you are getting sterilized, so this is the first step. एक बार ये start होने के बाद you will not touch the fingers here. Okay, you will put the soap like this everywhere first of all, and then इधर से ये देखो हाँ. Then you will take the scrub like this, and first of all you will start from the hand. Okay, and hands में firstly you will do the fingertips सबसे पहले in the rolling direction like this. Okay, at least 3 rounds clockwise then anti-clockwise, and similarly opposite hand का भी 10 rounds clockwise and anti-clockwise. Okay, then you will come to the fingers, and fingers को ऐसे समझो कि there are the 4 compartments, 1, 2 anterior, posterior, lateral and the medial compartment. So उसको there are many ways कि each finger को you can do like this. Okay, or another way is to do like this. Okay, so here you can see कि all 4 sides of the fingers are being washed. Okay, from the back here like this, and from the back here like this, and each finger then like this. Okay, then thumb, because thumb is not covered in that motion, so thumb के लिए we'll do अलग से. Okay, then for the back of this metacarpal head, okay, we'll do like this. 10 motions each in each direction. Okay, then we will have the palm, its anterior as well as the posterior aspects of the palm को. We will wash it like this. Then the wrist. Okay, so this is the hand complete. Now we will come to the forearm and the elbow. और ये ध्यान रखना है आपको कि एल्बो 2 सेंटीमीटर अबव द एल्बो तक बोलते हैं, एंड या यहाँ तक वी शुड स्क्रब। और एक बार यहाँ पे मैंने स्टार्ट कर दिया, नाउ आई विल नॉट टच माय रिस्ट एंड द पाम। ओके, so you scrub it like this, 2 centimeter above the elbow. Okay, and you should do it for at least 5 minutes. Okay, then the washing of this is important. Okay, so washing के लिए what you have to do, first of all, वही direction, first keep your hand, then come into your forearm and your elbow like this. Okay, and your direction should be like this कि water droplets जो भी हो वो यहाँ से होके ऐसे ही trickle करे, not like this. Okay, so इसमें there is a very obvious confusion कि that I have told you कि first we'll scrub the wash the hands and the wrist, then the forearm, and I've told you कि forearm पे after doing the scrubbing we'll not touch the hand, but we are scrubbing the forearm with the hand, so it is touching. So before going in the OT in practically what we do, we wash the scrub the hands first, wrist, the entire forearm above elbow 2 centimeter, then at the last we again follow all the steps of the hand, okay, which are starting with the rubbing of the fingertips in all direction 10 times both the hands. Then you go for the individual fingers, you can do it like this, the individual fingers, a or like this, anterior and the posterior aspect, and then your thumb, then your metacarpal wala area, then your anterior and the anterior and the posterior palms, then your wrist. Okay, then in the last, after we have done this, we'll not go again to the forearm and above elbow part, then we'll go for the washing. And in washing, just remember, it is very basic and very common sense wali baat ki, if you have to wash it like that ki the water from this part doesn't trickle or doesn't come back to the hand. Okay, so you wash it like this so that the water trickles down in this direction, and till you wear your gloves you'll keep your hand like this only, you'll not keep your hand like this or in the gravity, otherwise the water from the forearm and the elbow area will trickle down to the hand, which will make the hand again unsterile. Okay, so this is the basic thing that is followed. So let's see about the washing with the water. So सबसे पहले you have to wash your this hand and the palm, then your forearm and your elbow. Here again, after scrubbing the forearm and the elbow wala part, I am again scrubbing the hand, then I'll wash the hand. Okay, so I guess ki now your doubt will be cleared. And keeping the direction like this so that the water does not trickle down again on this part. Okay, see like this. You don't have to touch anywhere. You have to keep the direction of your limb in this way so that none of the blood trickles down, and you will not go again in this direction. एक बार हो गया like this, then like this. Okay, you will keep your hand like this. Okay. Now we'll see how. Okay, so this is the inside part of the OT. So I'll tell you the important things. First of all, this is the OT. This important thing here, it is your C-arm machine or the image intensifier. This is your OT lights. This is the ventilator and the entire machinery setup. And these are the anesthetists. And all this is unsterile. Only till now my hands, forearm, and this is called the trolley, the OT trolley. This trolley and my hands, only these two things are sterile right now. So I'll not touch anything else. Okay. So first of all, the OT trolley contains everything that a surgeons need, including the gowns, the draping sheets, the gauze. These are the sterile gauze, the gloves, the various instruments, the betadine, etc. So don't worry, I'll take a separate class about the instruments. What are the instruments and do they look like and what are the uses. Okay, so आज के lecture में I'll now tell you about how to wear the gloves in a sterile manner, that is the donning of the gloves. So remember, firstly we'll wear the gown, then we'll wear the gloves at the last. And while doffling, that is removing, firstly we will remove the gloves, then we will remove the gown. Okay, and then we'll do the painting and the draping wala part. Okay, so but before painting, some assistant will do a scrubbing of the surgical part of the patient with the help of that same 7.5% betadine scrub solution. And after scrubbing, then the surgeon will do the painting in a sterile way. And once painting is started, jahan pe painting is done, that part is converted into the sterile part. Okay, so anybody uh, apart from the surgeon, nobody will touch that part once the painting has been done. Okay, so you'll see all of this in this video. Okay, so let's start the video. How to wear the OT dress after scrubbing. Okay, so you can use this sterile gauze here, लेकिन इसमें भी यही रूल है, फर्स्ट यहाँ से the gauze use करने के बाद then to the arm, and you will not repeat that. Okay, then we wear the gown, and gown wearing technique is like this. शंकर जी इधर आओ, ये बाल में. Okay, first you'll open the gown without touching any side, and this is the front side, so I'll wear it like this, and one assistant will help me, but they will not touch anywhere in the anterior part or in the lateral or the medial side, only at the back. Okay, so I have wore it. Now we will wear two gloves. Okay. So this is the technique of wearing gloves in a sterile manner. Remember, before doing any surgery, we wear two gloves in each hand. Okay, two layers of gloves we wear. So we wear two gloves, and after the painting and the draping wala part, because we are painting the unsterile part, so there are high chances that some unsterile particle etc can touch the outer glove. So after painting and draping of the patient, we remove the outer wala one glove of both the hands, and then we wear the outer glove again. Okay, so remember this thing. Okay, first of all, open the glove like this. Then see, दिस इज योर स्टेराइल पार्ट. यहाँ पे आपका कोई भी हैंड टच नहीं होना चाहिए, एंड ये भी स्टेराइल ही है अभी, बट ये अंदर चला जाएगा, तो इससे यू कैन होल्ड द ग्लव्स. ओके, सो यू होल्ड द ग्लव्स लाइक दिस, कीप द फिंगर्स लाइक दिस, एंड we'll wear it like this without touching this part जो कि आपके exposed surface है. And just remember the gloves should be till the forearm. Okay, and now the second glove के लिए भी this is the sterile part, so I'll do it like this. Okay, without touching this side, because इस side में मेरा hand touch होगा without wearing the gloves. Okay, so I'll put the hand like this and I'll wear it like this. Okay, and similarly I will wear the another glove. Okay, similarly like this. Okay, so there's one thing you can see here that they are putting in the other limb of the patient, the non-operative part. So the thing they are putting is the cautery patch. Okay, the cautery patch, we use cautery in the surgeries for cutting as well as the coagulating the bleeders. So this is the cautery pad that they are putting here. Okay. Now I'll teach you how to paint the patient. Sponge holding. Yes, this is the sponge holding forceps. Okay, which is used to hold the dot. Okay, remember the sponge holding forceps is not kept inside the trolley. It is hanged outside the trolley because this is the instrument which will be in direct contact with the non-sterile part. So it will become non-sterile obviously after the painting and during the painting. So it is not kept inside the trolley. It is hanged outside the trolley as I've shown you in the video. Okay, so remember this also. So first of all, we'll make a round like this, okay, and we'll hold it with the sponge holding forceps like this, okay, and then we'll hold it like this and betadine से we'll cover it like this, okay, and सबसे पहले we'll paint that part जो कि first incision site होगा. Okay, so in this patient we'll do the DK below. Okay, see, this thing that is kept here, this thing, it is the tourniquet. Okay, in many surgeries, especially in the limb surgeries, to control the bleeding, we use the tourniquet in the proximal part so that bleeding is reduced during the surgery. And in this is a case of below knee BK amputation. In this patient, we'll do the below knee amputation of the right leg. Okay, so we'll apply the tourniquet. It will control the bleeding in this case, and also when we remove the bleeding after tying the vessels etc., we can see if the vessels are tied अच्छे से or if any vessel is left because there will be bleeding. So the use of tourniquet is this, and generally in the OT we use the sterile tourniquet only, and the surgeon himself puts the tourniquet. But here at that time sterile tourniquet was not available, so we have put a non-sterile tourniquet. But no worries about it also, because our incision site is just below the knee, and the tourniquet will be applied in the proximal thigh. Okay, so now let's see how the painting of the concerned limb or the surgical part is done. Okay, now abhi tak this entire part is non-sterile. Now we are converting it into the sterile part by painting and draping. So firstly we'll see the painting part. Okay, so we'll paint this part first, okay, then going into the proximal and the distal direction. Now this part is sterile. Okay, so nobody will touch this part except the surgeon. Okay. Then with the help of assistant, okay, ये ध्यान रखना, ये जो है स्पंज होल्डिंग, ये वापस से इस सोल्यूशन में नहीं जाएगा because it will make the entire thing unsterile. Okay, so I'll put it like this and then I'll paint the patient's limb from all the directions. उधर जाओ सर, like this. Okay. Now I'll throw this, and now I'll start the draping. Okay, I'll put this. Okay, I'll not allow this limb to be capped here because still the sheet and the table is unsterile. So I'll firstly make this entire table sterile by draping it or covering it with the sterile sheets. Okay, you'll see. Then I'll paint that unpainted part of the foot. Then I'll keep it on the sterile sheets. Then the entire thing will be sterile. Okay, abhi tak only myself, the trolley, and the portion that I've painted is sterile. Rest all is unsterile. Okay. So now we'll see the last part, and here you can see in the starting of the video we have applied the tourniquet. Now tourniquet mein it is very important to remember that you should not exceed the time limit of the tourniquet. In lower limb 1.5 hours, and in the upper limb 1 hour is the maximum limit of the tourniquet. After that, even the surgery is finished or not finished, anything, you need to remove the tourniquet, otherwise there will be nerve palsy, tourniquet palsy, and also there will be prolonged compression of the vessels, which can even lead to the gangrenous changes, and all these are will be gross negligence on the part of the surgeon, and anybody can sue you for this. Okay, so remember such basic things. Okay, so let's start the video. टॉर्निकेट, ताकि जब हम एम्पुटेशन करेंगे तो ब्लीडिंग ज़्यादा नहीं हो, ब्लीडिंग रोकने के लिए, एंड एट द लास्ट जो वेसल्स हैं उनको आइडेंटिफाई करने के लिए वी हैव पुट द टॉर्निकेट. नाउ आई विल स्टार्ट द ड्रेपिंग, एंड ड्रेपिंग हमेशा याद रखना एंड ऑफ द टेबल से स्टार्ट होती है. एंड नाउ ऑल दिस इज कम्प्लीटली स्टेराइल. ओके, सो आई विल पुट वन शीट लाइक दिस कवरिंग द एंटायर थिंग, both sides of the table. Now this is the sterile part. Okay, another sheet like this, and while draping or putting the sheet, you should remember that the sheet should hang down from the ends of the table. Then only the entire thing will be sterile. Not even a small portion of the table should be left undraped, otherwise it will be unsterile, and even a small mistake or negligence can lead to the infection in the affected part. Okay, so you have to be very concerned, and you have to be very vigilant about this. And then I'll put another sheet covering this the patient and the affected or the operative limb from the outside the area of your incision site, so that वहाँ पे कोई problem नहीं है. And then I'll fix it with an artery or towel clamp, anything that you get. Okay, so like this, and then I'll put another sheet to cover the chest and the face of the patient. Okay, so here is a fellow anesthetist, Dr. Sushma, जिनकी वजह से केस नहीं लग पाता. So very thank you. Thank you. Welcome. Okay, now I'll do the final painting. Baba Tiko? I'll again form that gauze. I'll put that in the sponge holding forceps. I'll use the betadine. Okay, and then with this sterile gauze I'll hold the limb जहाँ तक मैंने paint किया like this. So, and then now I'll do the painting of the distal most part. Not till now, I have converted everything into the sterile part except the unpainted part of the foot. So I am also painting it and making it sterile. Then we can put this limb onto the table, and then we can start a surgery. Okay. Now everything is sterile. The entire operative site and the table, the trolley, including myself, it is sterile. So the entire operative field is sterile. So this is the last part of the painting and the draping. It was not done till now. लिया गया उसको. Okay. Like this, I'll complete the painting from all the directions. Then I'll keep the limb in the sterile thing. Then we can start a routine. Just I'll remove this thing and I'll change the outer glove because it may be unsterile, and then we will start the OT. Okay, so this is the basic procedure that is followed in every OT, whether surgery or orthopedics. Okay, so अब इसके बाद जो inside of the OT होता है, so I'll take that in the next lecture कि tibia nailing कैसे करते हैं या amputation कैसे करते हैं. तो आज जो basic था that I have covered. Okay. So now in the next part, I'll show you videos of how to do the suturing and some basic ortho procedures like amputation or nailing, etc. And also very importantly, how to do the dressing, how to apply the slab and the cast, how to apply the CTEV cast. So we'll see short videos about everything. So this was the initial and the basic thing about how to wash the hands, how to make the operative part sterile, how to paint, drape, how to wear the gloves and the gown in a sterile manner. Okay, so this was about this. So donning, as we have seen, donning is wearing. So gown first, then mask or respirator, if the sterile ones are available, then goggles, face sheet, and in the last gloves. Whereas in the removing, first we'll remove the gloves. Okay, remember this thing. And gown should cover your torso, that is from the neck to the knees, and your entire arms till the ribs, wrist, and the gown should be tied from the back. So your assistant who is tying it from the back can touch only the back part, not the front part and the side wale parts. Okay, and in the doffling also the same part is followed. First of all, an assistant will come and it will untie the knots at the back side, then you'll remove the gown. Okay, so here are the steps of doffling of the gloves. Okay, here you can see how it is removed. And ऐसा नहीं कि एक gloves को remove करके you have thrown that into the bin. No, you remove the first, you hold it with the other hand, and then you make a pouch which will have the both the gloves, and then you'll throw that. And where you will throw that? You'll throw that in the red bin. Okay, so in green is your kitchen waste, paper, what etc. Red may you throw the syringes, gloves, that is the plastic waste. In yellow you throw the any soiled anatomical waste, including the gauze, the pus material. Okay, and whereas for the glassware like the vials and the implants, etc., you use the yellow bin. And for the sharp needles, etc., first you will cut first you will burn the needle using a special type of burner, then you'll cut the needle, then you'll throw that into a special sharp transparent type of bin is there. So I'll make a video regarding this also. Okay, so this was about today's lecture. I hope you liked the lecture. It was very interesting and very basic thing that everybody should know. Okay, so if you like the video, please like, share, and subscribe. And you can use my code, that is Anshul B10, while subscribing for any of our subscription packages on the Unacademy to get extra 10% off. Okay, so thanks for watching.